There's one small warning sign almost every senior overlooks: an itchy spot on your skin. Seems harmless, right? But in some cases, it's not dryness or irritation. It's cancer. Skin cancer in older adults often starts with what looks like a simple itch. But ignoring it could cost you the best chance of catching it early, when it's 99% treatable. Most people don't realize they've waited too long until it's serious. That's why this isn't about fear. It's about being informed. If you've had a spot that just won't heal, or keeps itching, don't brush it off. Your body might be whispering a warning. And today, you're going to learn how to listen. Welcome to Better Aging Advice, where we decode the small, often ignored signs your body gives you, and turn them into powerful steps to protect your health, your independence, and your future. This channel is for people who believe aging doesn't mean slowing down, it means getting smarter about how we care for ourselves. So if you want to stay sharp, strong, and safe, every single year you're gifted, tap that like button, subscribe, and hit the bell so you never miss a life-saving tip. And tell us in one word, have you ever ignored a strange skin symptom? Itch, bump, scab? Drop it in the comments. Your story might help someone else catch theirs in time. Now, let's get into it, because that little itchy spot on your arm or back might not be just aging, it could be your skin trying to whisper something urgent before it screams. Meet Mary. She's 68, a retired librarian who spent her days surrounded by books and quiet moments. After years of helping others find answers in dusty old novels, she had finally slowed down and was enjoying the calm rhythm of retirement in her small hometown. But then, something small, almost forgettable, started to bother her. It was just a tiny itchy spot on her upper arm. Dry skin, she assumed. Maybe a new laundry detergent, or just the winter air. She applied lotion. Changed soaps. Wore looser sleeves. Nothing helped. Weeks turned into months. The itch got worse. Sometimes it would bleed, then scab over. Then itch again. Still, Mary didn't think much of it. It's probably eczema, she told herself. Nothing worth bothering a doctor about. After all, she felt fine. No pain. No swelling. No fever. Just that spot. But something about it felt different. One night, after scratching it raw again in her sleep, she stood in front of the mirror and looked closely. The edges looked uneven. The center was darker than the rest. And that's when she got a sinking feeling in her chest. Her daughter convinced her to book an appointment. The dermatologist took one look and immediately ordered a biopsy. 2 weeks later, Mary got the call. It was squamous cell carcinoma, a form of skin cancer common in older adults. Caught early, it's almost always treatable. Caught late, it can spread quickly and become life-threatening. Mary had waited nearly 6 months. Fortunately, she acted just in time. But her story could have ended very differently. That small, itchy patch wasn't a skin nuisance. It was a warning. And today, we're going to walk through exactly what signs to watch for, so you don't miss what Mary almost did. Not every itch is harmless, especially after age 60. In fact, certain types of persistent skin irritation can be a red flag your body is waving, but most people brush it off. You see, as we age, our skin becomes thinner, drier, and slower to heal. So when something starts itching, we often assume it's just dryness or sensitivity. But sometimes, it's neither. That one spot you keep scratching? The one that scabs over, then comes back? That could be something far more serious. Two of the most common, and most overlooked, skin cancers in older adults are basal cell carcinoma, BCC, and squamous cell carcinoma, SCC. And together, they make up about 99% of all non-melanoma skin cancer cases in seniors. Both types often start with subtle signs: a small, rough patch, a shiny or waxy bump, a sore that won't heal, or yes, just an itchy, slightly raised area. Because they don't cause pain at first, they're easy to ignore. But here's the catch: they don't stay quiet forever. Basal cell carcinoma can slowly grow deeper into the skin and surrounding tissue if left untreated. Squamous cell carcinoma? That one's even more aggressive. It can spread to lymph nodes and internal organs if ignored too long. But when caught early, treatment is often simple and highly effective, sometimes just a minor outpatient procedure. No chemo. No radiation. Just early action. And that's the whole point. So many seniors suffer needlessly, not because they didn't care, but because they didn't know what to look for. They assumed it was a rash, or an age spot, or a bug bite that just wouldn't heal. By the time it grew or bled or changed shape, it was already past the early stage. The best thing you can do for your health? Pay attention. Look at your skin under good lighting, especially on your back, chest, scalp, ears, and arms. Notice anything that lingers, itches, bleeds, or changes shape. And when in doubt, get it checked. Because your skin tells a story, and sometimes, it's trying to save your life. What's your current skincare routine like? Drop a short comment below. Even if it's just nothing at all, you're not alone, and we're here to help. Let's talk about the signs. The ones that seem small, annoying, or easy to dismiss, but could be the most important warnings your body ever gives you. Most seniors don't ignore these signs because they're careless. They ignore them because they're subtle. Because the spot doesn't hurt. Or it fades, then comes back. Or they just assume, it's probably nothing. But when it comes to skin cancer, especially in older adults, it's often the nothings that turn out to be everything. Here's what you absolutely can't ignore. 1. Persistent itching or tenderness in one spot. If there's a patch that constantly feels irritated or itchy, even when your skin looks normal, it could be the earliest clue. Especially if lotion or creams don't help. This is what Mary experienced. It didn't look dramatic. It just wouldn't stop bothering her. 2. A sore that doesn't heal, or keeps coming back. Healthy skin usually heals quickly. But if you have a scab or small wound that takes weeks to go away, or keeps opening up again, it's a red flag. Skin cancers often masquerade as stubborn sores that never quite resolve. 3. A spot that's red, scaly, or crusty. Basal cell and squamous cell carcinomas often show up as rough or flaky patches, sometimes mistaken for eczema or dry skin. But if the texture stays or spreads, especially in one location, get it looked at. 4. Small bleeding or oozing, especially without an injury. This is a big one. If your skin starts bleeding in a specific area without any trauma, or if a tiny bump starts leaking clear or yellowish fluid, that's not normal. Even a little blood from the same spot, over and over, is worth your attention. 5. Changes in size, shape, or color. Even non-melanoma skin cancers can change over time. If you notice a spot that's getting bigger, darker, raised, or misshapen, it's time to stop guessing and start checking. Now, I know what you might be thinking. That sounds like a dozen little things I already have. And that's exactly why early detection matters. Most of these signs don't scream cancer. They whisper it. Quietly. But consistently. Later in this video, I'll walk you through a simple at-home skin check routine, so you can catch anything suspicious early and take action fast. And I'll also explain when it's time to skip the guesswork and go straight to your doctor. Because what's at stake here isn't just skin. It's your peace of mind. Your independence. And in many cases, your life. Stay with me. There's a reason skin cancer is most common in adults over 60, and it's not just bad luck. It's time. Decades of it. See, every time you stepped into the sun without sunscreen, worked in the garden, or took your grandkids to the beach, your skin was collecting more than memories. It was collecting damage. Now, here's what most people don't realize. As we age, our skin naturally gets thinner. It loses elasticity, moisture, and those protective oils that once acted like a natural barrier. Think of it like an old book cover, worn, faded, and easier to tear. That's your skin after 60. And that wear and tear matters, because UV damage is cumulative. That means it builds up slowly, over years, even decades. And all those small sunburns from your 30s, 40s, and 50s? They didn't go away. They just hid. Until now. But there's another layer, and it's even more serious. Your immune system also slows down with age. That means your body is less equipped to fight off abnormal cells, like the ones that cause basal and squamous cell carcinomas. In younger years, the immune system might detect and eliminate them before they grow. But in older adults? Those cells are more likely to slip through the cracks. That's why something that looks like an ordinary rash, itch, or scab in your 30s could be cancer in your 70s. And here's the part that hits home. Many seniors delay action because they don't want to bother the doctor or feel like they're overreacting. But when it comes to your skin, you are never overreacting. Mary thought the same thing. She almost didn't bring it up during her routine checkup. But when she did, her doctor took one look and scheduled a biopsy. That itchy spot? It was squamous cell carcinoma. Caught just in time. And because she spoke up, it didn't spread. No major surgery. No chemo. Just a simple outpatient procedure and regular follow-ups. So if you're wondering whether to get that spot checked, this is your sign. Drop a comment. Have you ever had a strange or suspicious spot looked at by a doctor? What happened? Sharing your story might give someone else the courage to act. Because here's the truth, getting older doesn't mean you have to be more vulnerable. It means you have to be more aware. And when it comes to your skin, that awareness could save your life. You don't need to be a dermatologist to protect your skin, you just need to be observant and consistent. A simple self-check at home can literally be the difference between catching skin cancer early, or not at all. So let's walk through this, step by step. Step 1. Get a full view of your skin. Start with good lighting. Natural daylight is best. Stand in front of a full-length mirror, and grab a hand mirror if needed. Look at your face, neck, chest, arms, and hands. These are the most common areas for skin cancer in older adults. Don't forget the tops of your ears, behind your ears, and your scalp, especially if you're balding or have thin hair. Can't reach or see a certain spot? Ask a loved one to help. This isn't vanity, it's vigilance. And it could save your life. Step 2. Know what to look for. You're scanning for anything new, changing, or unusual. Focus on itchy spots that persist. Sores that don't heal. Red, scaly, crusty patches. Bleeding or oozing areas. Spots growing in size or changing shape/color. It doesn't matter if it seems small. If it's new and doesn't go away, it's worth attention. One woman told us she found a strange dry spot near her collarbone. She thought it was eczema. Turned out it was basal cell carcinoma, and catching it early spared her from a large surgical removal. Step 3. Take a photo and track. Here's the key most people skip: document it. Use your phone to take a clear photo of any suspicious spot. Check it again in a week. Has it grown? Changed color? Started bleeding? Even subtle changes matter. Tracking helps your doctor too, because they can compare and spot patterns. And don't second guess yourself. If something feels off, it's better to check and be safe than ignore and regret. This habit takes less than 10 minutes, and yet so many seniors never do it. Why? Sometimes it's fear. Sometimes it's not wanting to make a fuss. But here's a truth I want you to remember: it's not fussy to take your health seriously. It's smart. It's strong. And it shows you care about your future. You check your car. You check your bank account. You can check your skin. Would you be comfortable doing a self-skin check? Or does something about it feel uncomfortable or confusing? Share in the comments. We're building a community here where no one gets left behind. Because aging with awareness isn't just about feeling better. It's about staying here, longer, stronger, and on your terms. Here's the truth that could save your life: going to the doctor for a suspicious skin spot doesn't have to be scary. Let's walk through exactly what to expect, so you feel prepared, not panicked. Step 1. The exam. Your visit usually starts with a visual skin exam. The doctor will look closely at the area that's been bothering you, and often check the rest of your body for any other concerning spots. They may use a dermatoscope, a handheld magnifying tool with light that helps them see details beneath the surface. This is totally painless. It's like a flashlight with superpowers. Some seniors tell us they were nervous before the exam, only to find it was quicker and gentler than they imagined. Step 2. The biopsy. If the doctor sees something that looks suspicious, they may suggest a biopsy. That sounds scary, but it's actually a small, quick procedure. They'll numb the area with a local anesthetic, so you won't feel pain, just a pinch. Then they'll take a tiny sample of the skin, sometimes just a few millimeters across. This is sent to a lab to confirm whether it's cancer, and what kind. You'll usually get results within a week. Mary, remember her from earlier? She said the biopsy was so simple, she was surprised when it was already over. And because she went in when she did, she avoided much more serious surgery later. Step 3. The treatment. If it is skin cancer, don't panic. Most common types in seniors, basal cell and squamous cell carcinoma, are highly treatable when caught early. Depending on the location and type, Treatments might include minor outpatient surgery, cryotherapy, freezing it off, topical creams, laser therapy or light treatment. These procedures are often done in the doctor's office, with minimal recovery time. And most people can get back to their regular routine the same day or the next. Early action changes everything. The number one reason seniors run into serious complications? Delay. Waiting just one more month can mean a bigger procedure, or worse. But showing up early, even when it's probably nothing, can mean the easiest fix possible. Think of your doctor not as a scary gatekeeper, but as your partner in prevention. Someone who's there to protect the health and life you've worked so hard to build. Have you had a skin check or biopsy before? What helped you feel more at ease? Share in the comments. You might ease someone else's fears, and keep watching, because next, I'll share the top daily habits every senior should know to prevent these spots from forming in the first place. Here's the part most people overlook: prevention. Because once you understand how dangerous a simple itchy spot can be, the best next step is making sure it never becomes a problem in the first place. These prevention tips aren't complicated. They're simple, powerful, and made for real life, especially if you're over 60. They don't require a complete lifestyle overhaul. Just a few mindful changes that stack up to big protection. Let's break them down. 1. Avoid peak sun hours, 10 a.m. to 4 p.m. This is when the sun's UV rays are at their strongest and most damaging. If you're over 60, your skin is naturally thinner, and you've likely accumulated decades of sun exposure already. That means you're far more vulnerable to new damage, and that damage doesn't just cause wrinkles. It can trigger skin cancers like basal cell and squamous cell carcinoma. You don't need to lock yourself indoors. Just shift your habits, run errands early in the morning or late in the afternoon. Walk the dog before breakfast or after dinner. If you're gardening, sit under a tree or wear a wide-brimmed hat. Even walking on the shady side of the street helps. Think of it like this: you wouldn't stare at the sun with your eyes. So why let your skin do it? 2. Wear broad-spectrum sunscreen, every single day. Not just for beach days. Not just in summer. Not just when it's sunny. Every single day. Even cloudy days let through up to 80% of UV rays. And if you're going out just for a quick walk, that's exactly how most sun damage sneaks in: small, regular exposures that add up. Choose a sunscreen labeled broad spectrum, which means it blocks both UVA, aging rays, and UVB, burning rays. SPF 30 or higher is ideal. Reapply every 2 hours when outside, especially if you sweat or wipe your skin. This one habit could be the difference between healthy skin and a diagnosis later. 3. Use protective clothing, hats, and sunglasses. Think of your clothes as your first line of defense. A wide-brimmed hat shields your face, ears, and neck, the spots most exposed to the sun. Long-sleeved, lightweight clothing keeps you cool and covered. UV-blocking sunglasses protect the delicate skin around your eyes, and even reduce your risk of certain eye cancers. Look for clothes labeled UPF, ultraviolet protection factor. That's like SPF, but in fabric form. Mary, the woman we mentioned earlier, now keeps a hat by her door so she never forgets. A simple trigger like that can turn a good intention into a life-saving habit. 4. Keep your skin moisturized. Here's something most people don't realize: dry, itchy skin isn't just uncomfortable, it's dangerous. When skin is dry, it's more prone to cracking, bleeding, and inflammation. This makes it harder to detect abnormal spots, and can even lead to infections. Use a gentle, fragrance-free moisturizer every day. Especially after bathing, when your skin is most absorbent. Seniors naturally lose some skin oils with age, so replenishing that barrier is crucial. It also keeps you feeling more comfortable, and makes it easier to notice any unusual changes. 5. Stay hydrated and eat for your skin. Hydration isn't just about thirst, it's about skin health. Dry skin can worsen itchiness, hide early warning signs, and slow healing. Drink water steadily throughout the day. Set reminders if needed. Your skin will thank you. And your plate? It's part of your protection plan too. Eat foods rich in antioxidants, like blueberries, carrots, tomatoes, spinach, salmon, nuts. These help repair sun-damaged cells and support your immune system from the inside out. Think of it as sunscreen on your fork. The bottom line: you don't need drastic changes. Just small, consistent choices that make a big impact over time. Mary? She started small. A hat. A tube of sunscreen by the door. Now, she's the one at book club reminding her friends, we wear sunscreen like we wear glasses. Every day. That's the kind of quiet, daily wisdom that protects your health and your future. Which of these habits are you already doing, or which one are you adding to your routine starting today? Let us know in the comments. Because when we share, we help protect each other. Mary's itchy spot might have been ignored forever, but because she took action, her cancer was caught early and treated successfully. You don't have to wait for a crisis to protect yourself. Start by checking your skin regularly, listening to what your body tells you, and seeing your doctor if something feels off. Early action saves lives. If this video helped you learn something important, please give it a like. Comment below with the first step you'll take to protect your skin. And don't forget to subscribe for more life-saving tips to help you age better and stronger. Your health is your most precious gift, start protecting it today.